So, as we have shared with you all, this session is entitled AI in Public Health and Disease Surveillance Enhancing Prevention and Pandemic Preparedness. So, although the pandemic is behind us, but it still is threatening and looming large on the surface and may strike back at any moment, may not strike back at any moment, but we have to be prepared. So, with those words, I now hand it over to the session chair, His Excellency Ambassador. May I request you, sir, to kindly take it up from here and kindly steer this discussion.
Thank you very much, AICRA, for giving me this opportunity. And I'm feeling very proud and privileged to be here and chairing this session. And I'm also very feeling always proud since I have been attending AICRA GAISA event for last, I think, 3 years consecutively. And I'm finding how they started, that time and how they have reached now here. It's very big progress, I would say. And the great achievement in this progress is basically going to the leadership of Mr. Rajkumar Sharmaji, who has really done a tremendous job. And I always feel proud whenever he post any of this information on LinkedIn or like this. So he's really doing fantastic job for our country, for different stakeholder, government, different ministries, academia, for the industry, for the startups. He's doing really great job. So with this continuation, I would also like to introduce.
Thank you very much, sir. I'm just humbled by this august gathering, and I'm here not to represent my company. I'm here because of the background. I used to work in the UK, specifically developing algorithms using medical data, closely working with NHS. At University of Cambridge, and then on drug discovery. Some of the projects have come up as the clinical trial drugs now for both malaria and Alzheimer's. And currently I'm associated with one of the government programs called BIRAC, where central government is investing in hospitals to make use of patient data ethically, responsibly and securely to generate innovation within India. Because yesterday, I'm sure we have discussed it so many times, the innovation should happen within India, and the government has already taken a lot of initiatives under BIRAC scheme, and it has invested heavily in some select hospitals, and I am now advising on security aspects of how to make this data available for other Indian startups, other Indian companies to make use of this data to develop algorithms on this. That is my brief background.
Hello. First of all, good afternoon, everyone. And thanks to AICRA and for inviting us and getting a great session out of this, and also the general exhibition also. We went through the different panels, the different discussions. All of them were really insightful. So I'm Vinod Neelnath. I represent UST, like a primarily Indian company, which is based out of US also. Our motto is actually touching 1 billion lives. So what we believe is also how to give back to humanity and how to touch the human lives and make it more stronger. Of course, we are now pioneering in AI and especially in Gen AI when it is coming, to see how that can impact the person's life and how it can be given back in each of the areas. So really thank you for being part of this discussion. Really looking forward to getting more insights.
Good afternoon. Hello. Good afternoon, everyone. I am Colonel Amit Shah. I head the Department of Urology, Renal Transplant and Robotic Surgery at Army Hospital R&R. We are a huge load hospital carrying on extensive workload on renal transplant and robotic surgery. We are the only robotic center in armed forces. So I look forward to having multiple interactions in this session.
Good afternoon, everyone. I would like to thank AICRA for making me part of this panel discussion. I represent Vasudev Health Tech and ML Health 360, and we are into AI. We have developed an AI solution for radiology, particularly CT scan. So we are into diagnosis and radiology services since long, but the outbreak of COVID has pushed us as well as the healthcare industry to adopt AI. And that's when we started thinking about AI and to making the diagnosis and to making the healthcare industry more powerful and better in terms of providing accurate and good results. So would like to see the opinion and of other dignitaries and would like to be part of the discussion. Thank you.
Thank you, everyone. Let me give my introduction. uh, I have been working in healthcare technology, impact and innovation since last 30 years in healthcare in India, and then for last 15 years internationally, including India. And I'm the first person from India who basically created the digital health and AI health market since not from today and yesterday, but from 1993, right, when nobody was knowing what is digital health. And some of the very premier institutes in India, the top technology related with medtechs and those I have launched in India, and many of the centers, including your R&R hospital, they are using some of the best technology in India. Like in R&R, you have in your dental department, there is one machine called Newtome, which is basically the India's first cone beam CBCT technology that I launched almost 15 years ago, not today, 15 years ago, in 2005, and I represented during the first IDC conference, which luckily held in 2005 in Delhi, because IDC is International Dental Congress, which never actually comes in India so easily because it comes by rotation, different countries. So I launched those technologies, and then there are many technologies related with the different surgical and non-surgical and diagnosis related, pathology related, digital radiology related, flat panel technology related. All this technology I basically launched first in India. So those were some of my achievements. Then I basically started the startup in healthcare technologies market driven by digital health and AI health. Since last 30 years, I built from scratch 17 startups, all international standard startups, all global startups, which are now huge, very big multinational company, right, having at least 10,000 people. But when I built them from scratch, they were having just 5 to 10 people. So thereby you can understand my knowledge became so big, like a big think tank, because I learned the medical science, which many times I would say some of the specialist physicians, they are also not able to learn, because they learn what is taught to them. I learned what is required in the global level in different surgical and non-surgical areas. So I have created, I learned, because I am basically a technologist. I am a robot and AI scientist, basically, right, by profession. But by practice, I am a medical technology professional, a digital health and AI health domain expert. And out of those 17 global startup which got converted into multinational, one of them is my current company, Bionovimed Healthcare Group, for which I am the Chief Global R&D and AI Health Innovation Officer and founder and CEO. And our business is in more than 40 countries, and we are expanding to 180 countries globally in next 5 to 10 year timeline. And we are making Bionovimed Healthcare Group more than $300 billion global company. So that kind of a very aggressive working capability we have created. And because of my achievements and capability, before COVID-19 pandemic, WHO Geneva actually selected me as an expert member for digital health and AI health innovation, whereby I was advising to Government of India and more than 40 countries' governments, Ministry of Health, about how to roll out digital health in public health related with non-communicable diseases and related with COVID-19 kind of infectious re-emerging and emerging disease, right? And how to manage during COVID time NCDs like cancer disease, because that was the biggest challenge. Without COVID-19 pandemic, managing NCDs were itself was a big challenge, especially country like India, because we have huge patient pipeline, and the hospitals have limited resources, limited number of oncologists, right? And because of the COVID, people were restricted to visit hospital because of not getting infection and all. So thereby, the cancer patient were getting advanced, right? So there was more problem, right? And we were basically trained by WHO how to manage under those circumstances, the most critical circumstances remotely, using AI health, using digital health, right? In all these disease area in different local settings. Because the problem, the local setting problem related with the US is different than in India, right? So we have to be dynamic as per our local country, not as per the US government. What is happening in current scenario, whatever Western company they want to basically sell to India, we, as it is, we take it, right? We do not involve our own think tank, and that is why we fail. Because we are not understanding our local problem, our local challenges in our hospitals, in our local system. So those are some of the things. So I'll stop about my introduction, and let's start with Colonel Amit Shah, because he has a lot of clinical surgical area experience, so we want to learn, and that is much more interesting how AI can basically help in those surgical and those settings. Yeah, thank you.
Good afternoon, everyone. To this August gathering, I bring greetings from Department of Urology, Army Hospital, R&R. It's just across the road. So, taking a humble beginning, 10 years back, when we started our robotic surgery training, the robotic company used to write it as taking surgery beyond the limits of the human hand. But after getting trained and now working as a trained robotic surgeon, I feel that robotic surgery is perfect combination of human skill and mechanical precision. So we always write robotic assisted surgery whenever we talk about any surgery. It is the surgeon behind the robot who does the surgery, robot only assists it. Correct. So this question never arises. So at this juncture where life expectancy is increasing, the disease is expanding and it's going beyond the understanding, especially like COVID-19, which was beyond human understanding. There is increasing workload, there is strain on critical team and care team resources, and obviously it all lands to clinical, financial and operational outcomes and leads to pressure on healthcare organization. So how do we, as surgeons, how do we tackle these problems? Like surgeons' breed is a never die, never give up. We are that breed of human beings. So how can we make surgery better? It will always better. What happened 200 years back or 100 years back in World War I will never happen now. It will always improve. Is there any optimal way to perform surgery? It will always be no. We'll always keep on improving, whether we use human skill or we use technology, but we'll keep on performing better and better surgery. There is no end to that. But what we can do using robotics and AI is that we can enable the mastery of surgery. That is what we are looking forward to. So how do we achieve this mastery? We can achieve this mastery, technical mastery, we can achieve it with clinical mastery and operational mastery. So since this is a robotic and AI forum, I'll only discuss technical mastery. How do we improve it with robotics? I'll not go in details in the other things. So if you read history about robots, it actually is a Czech word robota, which means labor. The concept started from combat fields only. The golden hour, the platinum minutes, where you immediately act on the casualty and try to save his life. And give a on-site, on the battlefield site, surgical assistance. So this and the space project also added to this concept. So initially, post World War II, and I must reiterate here that all the war has taught surgical field something new. So post World War II, everything started to be automated in the operating room. But later on, we realized that we need something on site, whether it's a space station or it is in the battlefield, we need a surgical assistance there. So that gave the concept as early as 1920s to develop a robotic system or a robotic surgery. So in 1980s, when the early robots came, at that time the so-called glamorous surgical branch, neurosurgery, cardiac surgery, started with practice of doing the robotic surgery. And the Da Vinci era got the master-slave concept robot. But however, it was urology which grabbed the opportunity, probably because of the favorable anatomy of the human pelvis, which was deep, where human hands do not reach even in an open surgery. Kidneys lying on a vascular pedicle, which is very mobile. Urinary bladder is a mobile organ, so we can operate very easily with a robot. And prostate organ, which is lying very deep in the pelvis. So at present, we have our robots which are master-slave concept. The surgeon is the master and the robot is the slave, which works on the patient with a cart, and we operate from the surgeon's console. So this can be as far as, I'll show a slide where New York and Strasbourg operation or something, it can be too far. What is the wonder in robot? What has a robot offered to the surgical field is the 7 degrees of freedom. You have a human wrist inside the body cavity with a 3D magnified vision. So all instruments have a movement which is 7 degree. I'll try and show you with a video where you can understand what is 7 degrees of freedom and what actually it gives the surgeon the leeway and the maneuverability of doing an extensive surgery inside the human body. So this is a robot arm, and this is a stapler which I am using it as a showing you the 7 degrees of freedom. So this is the slave, this is the master, which controls the robotic arm. So this is a device which we are stapling any organ or any vast structure. This is what I mean by 7 degrees of freedom, like a wrist inside the body. So with a wrist inside the body, how does it help us? I'll show you in the other video which is following this, where I'm suturing. After removing, I'm working deep in the pelvis. This is the bone behind the pubic bone. I have removed the prostate. Now prostate is the organ between urethra and the urinary bladder in the males. So I have removed the prostate. So bladder is lying here. The below side, and urethra is there. So now I am joining both the thing because I have removed the prostate. So I am doing an anastomosis between bladder and the urethra. And this is the two robotic arms which I am controlling, and it gives me extensive amount of movement. See the movement which I can do. This cannot be done with an open surgery or even with a laparoscopic surgery. It can only be done by a robotic surgery with a robotic arm. So this is the amount of maneuverability we get deep inside the pelvis, and this is 10 times magnification. So you see everything so beautifully magnified that it's just amazing to operate with a robot. So having now explained to you what is 7 degrees of freedom, what maneuverability robots can give, and how magnification and 3D vision we get when we operate. So these are the things which is the advantage with a robot. So obviously with these advantage, there is 10 times vision, there is tremor elimination of the human hand. Surgeon ergonomics are better because we sit and operate, and obviously patient gets a faster recovery, lesser complications, and improved surgical oncological outcomes. So India robotic surgery has had an exponential growth. The first surgery was performed in 2002 with a cardiac surgery. As I said, cardiac and neurosurgery were the glamorous branch. We picked it up later, but we grabbed the opportunity. The first robotic surgery, urology, was performed by AIMS in 2005. Until 2022, we have around 100 robotic systems. Now it's more than 120. And cumulative, we are doing 50,000 surgeries, mostly dominated by urology. And we in Armed Forces had our first system 2014 at R&R, and still we remain at 1. So future from here, robotic platform, as I showed with you with that surgical video, it can be emulated to other things also, interventional radiology, cardiac surgery, ENT. Everyone can get those expansion of robotic benefits. Corporate setup has grabbed this opportunity and they have had an exponential growth. Government setup is lagging behind, but now we are picking up. Even though our clientele is multifold, our workload is more than the corporate load, but the opportunity is knocking the door, but I don't know, I'll put it up to you. Are we resisting to open that door for us? Issues are multifold. Our manpower, the way of working, especially the procurement, and now since March 2023, government has removed robotic from Make in India exemption list. That has added to the troubled waters. And how do we expand from here? Like since 2014, we have only one robot in army. Ideally, we should have had General Dash sir is here. He has been trying for last 7 years to get 4 more robots, but we are still in the troubled waters. Future is there. The technology will keep on. You all are here to advance the technology. This August gathering is for that only. The AI technology and everything, how to increase the application of AI and robotics in healthcare. This gathering is for that only. You will be working up with all startups and doing everything from this, and we are the users. Cost will definitely come down as multiple pioneers will come in this. We hope to have a similar development in our Armed Forces Medical Services too. Training status, I said we only have one robot, so our training status is lacking. Like after General Dash sir, I am the only robotic surgeon and few more, 3-4 in a pool of 1,000 officers. So we have access lacking, platform availability is less in all government setup. Why to talk about only Armed Forces Medical Services? And fellowship, since availability is low, so fellowships cannot be done. People have to apply to corporate setup to get fellowships. So what I have been suggesting everywhere, that we should have a sturdy platforms at all command hospital. We should have one robot surgery, so that junior surgeons get access to it and can apply for fellowship and get trained under senior surgeons. As I said, we have been trying, General Dash sir has been trying. We have since 2017 procurement of 4 Da Vinci, which is still in abyss. So hard truth is, we all have zeal in it. Like Indian Army's standard verbatim, do you have it in you? Yes, we have it in you. We need your support to get to because robotic surgery is a boon to the surgical field, and we have to embrace sooner or later with full heart. AI also has a applicability in armed forces, like it can be used for triaging the battle casualties, tracking them from movement from battlefield to the nearest echelon of medical health services, training the battlefield nursing assistants where AI is being used, monitoring and delivery of medical logistics using drones and AI. That is being worked upon. So AI has a lot of possibilities, like you all know it. We can have a AI driven car. Somewhere someone said that robot performs first laparoscopic surgery without human help. I think it's unlikely. Human skill will always require, because all human bodies are different. We always say in medical practice 2 + 2 may not be 4. all human bodies are different. So applying AI to 50, 60 billion people, it will be very difficult. So human skill and human mind will always require, we always will require to train a surgeon to sit behind that robot. So we military aim at sitting at R&R and operating in a robotic space station, or in the battlefield near you, near us. A last week article by Joshua Sterer has said that AI can be used for navigating the new frontier of the military medicine. Very beautiful article. I have written it. You can read it. This is what I meant. Before I close down, this is a famous Lindenberg trans-Pacific surgery done from New York at a patient in France. Our chief, General Manoj Pandey, said on Army Day, this 2024 is for Indian Army. It will be a technology absorbing year. So with this, I hope that we get all technology support possible from industry and the government to make our medical services even better and better. Thank you.
Very impressive presentation Colonel Amit Shah has given, and the point he mentioned is really the real pain points and the real the advantage of using robotics in surgical application, because yes, initially it started with urology, then it went to other surgical interventions, and now it is expanding to further new surgical, and even in the dental area also, especially like for treatment planning and like in case of implants, dental implants. So there also it's using. Thank you,
Thank you,
Colonel.
sir. Thank you, sir. Thank you for
Thank you. Please.
this opportunity.
Okay, thank you. I think that was very insightful and really understand the pins. So, again, I will actually put the points on what we can do with AI on smaller issues. I mean, I think we always, when we talk about technology, we take to the biggest thing we can do and actually think what are the possible hindrances in doing that. So, when I take AI, now currently, the first place AI can play is healthcare is one area where there are 4 or 5 major players. The number one is, of course, the decision makers, the government, the policy makers. That's the first category. Second category is the providers, all the hospitals. Third category is the labs, the clinical laboratories, the vaccine centers, etc. Fourth is the insurance providers. And fifth are the patients or the citizens. So all these 5 people are part of the healthcare system. So now data is with all of these people, all of these areas. The first place where AI can play is data integration in all these things. So we have seen that example when COVID was happening with COVID coming in, with Arogya Setu coming in, and then it generally went to ABBA and all. But I think at the end of COVID, it died out. Actually, we should have made that as the beginning of the single data collection of the data collection of the health part of India itself, because it was a excellent initiative which came up very fast, which people never thought would happen. People never thought that we would have COVID certificate, like vaccine certificates for 1 billion people. That was all discarded by everyone, but that became a reality. But that reality we should have built up. So first part I would stress on AI is on still use AI for data integration, because once the data is integrated, because we always say that lack of data is a problem in many areas in AI. We don't have that problem here, touch wood. We only need to make sure using AI itself to integrate the data and get it from one thing. And I think like when I read about what ABBA is trying to do, what other things are doing, we have the vision. We just have to execute that with AI. The second part is AI in healthcare is not about replacement. So whenever we hear AI and automation in industry, people always tell, okay, how much people will you replace? I mean, that is not the question which intelligent automation or intelligent AI is coming in. It is actually what you touched upon, Colonel. It is actually empowering the decision makers, because AI is not going to be a niche technology which will not have a chief AI person everywhere. Rather, it will be the domain experts in every field using AI seamlessly and ubiquitously. So there are tools, there are things made in the industry where the domain experts, like Kernel itself, can use AI independently without an AI expert. So why would they do that? To empower them in the decision making. That can be used in all levels of the domain experts in the health industry. It's not just the doctor, it's also the policy makers itself. They will get the data in their fingertips, what they want. In remote areas, it can be used by the medical assistant. There we have some people from the government who do this work as health workers. They need not be doctors and all. They can be really empowered with AI to do the first steps itself on this. So that's a second area which AI can drive in, and where a lot of the technology can help also. So I'm not coming to the bigger things now. So I'm just touching the smaller things, because that can impact more people widely. And the third part is where people are more interested, and actually that is where the studies are going. How can we actually predict that from the data? How can we predict pandemics or whatever similar things in a much faster way? How we can isolate that before, etc. Once that is known, how can we actually look at that? So prediction is not just for a region-wide thing like a pandemic now. It can be prediction down to a center. So for example, in the case of R&R, it can be for military in certain area. Is something happening in our center, which is like an anomaly, which can be highlighted. It can be for a person also. Something is happening. Our reports are sent. Like if you look at lab reports 30 years back, you would not understand anything, because you will have all the measures. 25 years back, they started putting the range. That itself was a big thing, because now you know that, okay, you are in red or green or blue based on the limit saving. Now think that you have applied AI. They will do the correlation. They will see what has happened from your last report to your current report, and just start recommending what is the next steps, etc. So in the personal area also, the predictions can work in dog. Then the last part, if you know, like now, when we come to prediction, decision making, data integration, the last area of AI and Gen AI is actually looking at how we can forcefully do the collaboration of many of the agencies, because health is also a collaborative scheme. We have the problems of prices, the insurance thing, etc. How we can actually get to a recommendation system where what people need to do and all. Because actually applying health insurance in India is actually more difficult than studying AI. Because I really like the questions they ask and what we answer, and then whether we know whether we are covered or not covered is a bigger science, and then the learning the mathematics and statistics needed for AI. So to make it simpler and to make sure that each people have the needed policy they need is actually something which AI can give. At the same time, highlighting the risk for the people who are providing that, the providers and the insurance, etc. Because we don't want a win-lose system. That will never work. It should be a win-win system on both areas. So these are the areas actually where we want to try to pitch, and we want to debate on how to make that. So sometimes when we don't do the small things with AI and expect that the bigger things will come with the force, it never happens. So let's put our effort to see how we use AI in our daily areas and in the areas of health, which will actually help all of us to do better things. So I just cue to the next speaker so that others have the opportunity. Thank you.
I'm Dr. Kaushik Hatti. So I would just share some of the things that I have been part of in using AI for healthcare, specifically clinical decision making, as well as developing new clinical methodologies. It could be drugs, etc. So in the UK, for example, there are something called TREs, which is Trusted Research Entities, where in UK the healthcare system is largely government owned. So it is NHS. Every data that is taken from NHS is fed into this one monolithic channel called TREs. They are dedicated systems in some some places. And this, there is a proper policy and channel wherein any researcher within, it could be a clinician or another tech company or anybody else who wants to access this data, there are proper legal and ethical ways of accessing this data, and this can be taken to innovate in AI. As already other speakers said, AI is nothing without data, and especially in India, there is no dearth of data. There are so, I mean, our volume is our strength. So this is what one of the key objectives that India is trying to do, that I am aware of at least, wherein they are investing. The government of India is investing in select hospitals where already clinical trials are already being done, so that the data from these patients are ethically, responsibly, and securely sourced to do innovation within India. So usually we have seen this in many instances, and as Colonel was also telling, when we try to import any other technologies or even AI models from other countries, it is not necessarily suited for us. One of the examples that I can think of is this oximeters, wherein it was tested on all Western people. They are not at all dark skinned, but when it comes to Indian people, they did not perform as expected. So even though the oxygen, the reading was telling it is high, because it was because of our melanin, not necessarily it was accurate. So these are just a few examples of AI not properly trained for those local areas. So in one such key objective, a particular hospital in the Kerala is trying to do this for a tribal community to identify spread of next kind of pandemics or vector-borne diseases. Kerala is naturally very rugged terrain, full of hills, and it is very prone to vector-borne diseases and spread of vector-borne diseases. As you might be aware, they had several such disease spreads in the last few months actually. So how can decision-making bodies, government decision-making bodies, take cues from these, from the hospitals that these patients or these early incident responders go and report to, and as soon as they report, how can decision makers take appropriate measures? Instead of people coming to the nearby hospital, how can we send nurses or other people to the areas to contain them so that the spread is reduced? So these are one public decision making where data can be used. The other thing is, as I already mentioned, even for innovators, it could be even small companies who want to have, for example, I want to come up with a new way of detecting breast cancer from mammograms, for example. So then how do you get these mammograms from hospitals? And ethically and responsibly, and how do you use it for Indian context? And obviously India is a subcontinent wherein we have so many kinds of people with different genetic pool, etc., etc. So whatever works for Kerala need not work for Assam. Whatever works from Assam need not work for Punjab. So how can we also do it in a personalized manner? So in this context, these institutes are being set up. One is in Kerala, as I mentioned, which is called BioNest by Government of India. And one of the key things that as soon as we started this, one of the key things that we noticed was the hospitals are not prepared to give the data. They want to give, they are not prepared to give the data because of security reasons. So this is a huge gap in the way the data has to be made available. So when obviously there are legal repercussions, privacy repercussions that are involved, and it has to be made available in a particular manner, in anonymized manner or pseudo-anonymized manner, whatever they take. So in this context, what we are trying to do is help these hospitals increase their own security levels, data security levels. It is not a problem just for India; it is worldwide. When it comes to data security and any kind of cyber security, generally of all the sectors like logistics, insurance, or supply chain, or fintech, healthcare is actually the least of all. Not because of their problem, it is because of the environment. Like not necessarily anybody would be highly trained in IT or etc., etc. So naturally, health sector is the most victimized. Even from international reports, the success rate of ransomware, as you might recall, what happened in AIMS, the success rate of ransomware attacks are highest in hospitals. So hospitals are actually sitting ducks for such kind of problems. And that's not the only thing. Because of their own natural unawareness of the challenges and problems existing all around them, they are unable to tackle this. So this is where we are trying to ensure a pipeline and a process is put in place to make sure the data is used by whoever wants to use it in a responsible manner, but also secure manner. So there are few steps that we are taking to ensure this is done. So just to give you an example, this is one hospital, it is not even huge hospital, as I said. They see about 2,500 patients every day. So that's the kind of data they have. They are already digitized. They don't necessarily write everything in a piece of paper. It's already digitized. The data is already put in a particular manner which can be accessed by anybody in a proper manner for any AI training. But how do you make it available to people ethically and responsibly and securely is the challenge that we are addressing right now. And this is a challenge in not just one hospital, but I think many hospitals, especially private-owned, even government-owned hospitals. These are some of the challenges we are addressing. I will stop it here. If there are any questions, I'll be happy to answer more specific questions.
Yeah. So I would like to divide healthcare in 3 segments. One is preventive, and second one is diagnosis, and third one is treatment. So as already shared by Colonel Shah, that AI in robotics and AI in logistic management in healthcare industry. So there are various other fields in which AI is very much important, and all of us, and including Western world, are working on healthcare industry on different segment of AI. Like in robotics, AI is very much useful, and nowadays we are witnessing that it has got lots of easy and easily available solutions with the help of AI. So other one is diagnosis. So in case of diagnosis, if everyone is working on AI, and if we include AI in diagnosis, then the results through AI tools will be much better. And third one is patient healthcare monitoring. So that is also a very important segment because in highly populated country like India, patient healthcare and monitoring is a little bit difficult. So with the help of AI, with the help of various tools available in AI model, we can remotely monitor the patient health, and we can remotely advise and suggest them the way of treatment. So it has lots of potential, the AI in healthcare. So like in drug trials also, all the people have started using AI models. So a report published by Statista in 21, AI market globally was of $11 billion, and it is expected to get raised up to $188 billion. So it has huge potential, and as well as because healthcare is very sensitive segment in industry. So if everyone start developing AI tools for all the 3 segments which I shared, then definitely it is going to help the healthcare workers as well as the patients in many ways, through which we can save lives, we can enhance the way of treatment, and we can prevent the disease also. So I think we have a huge potential, and we have huge market in which, and we have huge requirement. And being a highly populated country and the biggest populated country in the world, we have huge opportunity, as shared by my colleague, that data is the biggest challenge in developing an AI tool. So we are already ahead of the Western world, because we have super brains, we have high population, so availability of data is more. So I think we should focus more, we should do it more dedicatedly so that we can develop the solutions, and these solutions developed by all of us will be helpful for our nation. That's it. Thank you.
As I have been working in healthcare technologies, impact innovation for last 30 years, what we have learned in the last 30 years is that not just one area you have to fix the problem in healthcare, but you need to have an integrated care from end-to-end solutions you have to have. That means what is end-to-end solution means, which we developed in our Benevimed Healthcare Group. End-to-end solution means right from the prevention to early detection, to diagnosis, to prognosis, to doctor consultation, to treatment, to complete disease management and control. This is what is required. This is the need of our today, not only in India, but all across the world. And this kind of novel technology solutions, Benevimed Healthcare Group, we have done. Because before we started this company, right, we first established our think tank. We established our global R&D and innovation lab based in India, right? And there we realize that unless we work on all these areas using AI and using digital health, using the latest advancement of medtechs, including robotics, we are incomplete, right? That is why we have to have the end-to-end. Like today, what we have seen in last 5 to 6 years, maximum focus of AI is given only in diagnosis, right? I always question them, and then those people run away from my questions. I say, okay, you achieve good success in fixing the diagnosis problem. What is next? Say, I know I got a cancer of type stage 3. What is next? I do not have the accessibility of good cancer specialist. So what is the use of this diagnosis? Even with the AI, no use. I have to die, that means. So that is why we have to have the complete end-to-end solutions for accessible, affordable, safe quality health to all. Unless we achieve this target, we are incomplete in healthcare delivery. Because healthcare quality delivery is important. Not just delivery, but safety and quality delivery, which is very important. And what we have realized that everybody is talking about AI is good. AI has huge power to transform our healthcare. But it has huge risk also at the same time. Because if you give gun AK-47 to terrorists, they will kill. But if you give that same gun to defense personnel, they will save our nation. They will save our borders. So that is the difference. So AI has to be basically driven by domain experts in healthcare, not anyone. That is very, very important. Because the domain experts knows the risk and opportunity. Otherwise, you know the opportunity. You will apply, but you are creating big risk which you might not be knowing. Right? Because you do not have experience. You do not know because you do not have experience. Like a robotic surgeon, he knows much more better inside of the healthcare. Because they are opening somebody's body and doing surgery, so they know inside and outside of the complete human body and treatment and all those. So they know each and every risk. And they know the power of AI and power of robotics and technology. But not every surgeon, but not every physician. So that is the point we have to always take into account, that whom we should endorse and support and whom we should not. Because otherwise, if we say, no, AI is doing great job, no. It is not AI, it is the man behind machine. The man behind machine get full credit for AI delivery and AI built solutions, not the AI. Because AI is basically governed and managed by that expert, domain expert, and that domain experts are basically a group of people. The physician scientist, the data scientist, the business leader behind that delivery solutions, right? The technologist, the solution developer, right? So it is basically the integration of all this, right? And overall, when we see regarding the AI development and AI delivery and solutions, like India is having the best position in that sense. Reason is India has the biggest database, but the biggest weak point with India is that our database is not uniformed, it's not dynamic, it's not accessible so easily, because we have been trained that, oh, we have to keep confidential, we do not have to share data, we do not have to share patient data. So this is the big gap. This gap we have to remove. And how we can remove the gap is by educating and training those stakeholders. That sharing has to be done, but that sharing doesn't mean you are giving the open data. You are giving the annotated data. So that any researcher who are going to use this data, they should not know the personal profile of those individual data, right? But you need to share, and you need to share freely. Like when I was as a WHO Geneva member, I used to tell to Government of India, Ministry of Health, that you have to create this so fast and aggressive manner, educate each and every stakeholder that sharing of data you have to do very freely. But still what I am realizing, still it is not freely, it's very hard. If you approach any hospital, everybody say, no, it's very confidential. I am not going to give, because government said, no, it has to be confidential. But believe me, under the table, many private hospitals are selling big data, and at huge cost. Thank you. Yeah, if anybody has any questions from my side or any of the panelists, yeah. Their privacy is there, but under the privacy, you still know the individual patient details. But in AI, what we are talking about is that you don't have to know each and every personal records. Like what is the name of the person, what is the business of that person, what is the education of that person, what is the family background of that person. Those personal information should be confidential. That is the basic purpose.
Sir, can I just add one more comment on that? Yeah. So actually, Government of India has passed Data Protection Bill last year. So that takes care of some of the issues that
I have a question. So my question is to Colonel Shah and Kaushik. So if we talk about cancer and oncology, right, there is a diverse team of physicians. There's the radiologist, imaging people, there's the oncologist, there's the pathologist, which is doing the confirmatory diagnosis.
Yeah, that is called multidisciplinary team. Yeah.
Right. So and there's this concept of molecular tumor boards, where all these different specialties come together.
Right.
And
we are
let's say if there is a cancer mutation which is not actionable, which doesn't have a targeted therapy. So I was just curious to know your thoughts on that. And the second question, I'll just say it right now. So integrating AI into a clinician's workflow is very important. So these Gen AI tools, we all know, are capable of making mistakes called hallucinations, right? So if I use an LLM for differential diagnosis, for making, I put in my patient's history and symptoms and get a answer. Now, if a human has to verify whether the LLM returned the correct output, then we have actually made the human physician or doctor less efficient. So I was just curious to hear your thoughts on how to integrate it into a typical clinical workflow. Thank you.
So
I had a question, I had a comment and for the gentleman who just now said. So as it turns out, so I just had a comment on the gentleman and then I have a question and a comment. So to the gentleman who just now said, as it turns out, human in the loops for differential diagnosis especially, it's been shown that AI alone outperforms both human or human with an LLM. Just so we are all on the same page. This was stuff that has come out just 6-7 weeks back. So both from Google as well as from Meta. So that's one thing. The second one is we are completely ignoring this open problem that we are having. India doesn't have as many doctors. If you go into rural places, you have like severe shortage of doctors. So why is it that we are not talking about the fact that the tools that we have can be used for primary care as to like first line of at least telling if a problem is there or not, or how severe it is, to kind of not to make a diagnosis, but to kind of at least tell them that things might be bad or to go to a doctor, because we have a severe shortage of doctors here. So especially in rural districts, they all have smartphones, but they don't have access to doctors. So why are we not talking about that? Like using these tools to actually be first line of interaction.
yeah, we developed that, and we are working with the government on those areas.
Yeah, can I? Is it okay if I answer the previous question?
Yeah, please.
Yeah. So I will just start with your question. Because, so again, government has already taken initiatives. There is actually a proposal which was called 3 months back, which got over, I think, 2 days back, specifically to address the problem that you have raised. How do you use LLM to reach remote areas where there is no clinical presence, any doctor? So especially in rural, tribal, or terrains which are not accessible. A call was made and they have specifically told that use of LLMs for addressing public health issue, especially issues which are not very critical, like I have fever, I don't know what to do. If you take care of that immediately, it will not go bad, it will not aggravate. So that kind of thing. So a lot of things are already happening under BIRAC program. And I'll just come back to another question about LLMs. As you already pointed out, use of AI has actually shown that it can define and identify, do right diagnosis even when humans are not able to do it. I can just give you one example, specific example of Google, wherein they developed a predictive diagnostic tool to identify glaucoma. If you diabetic retinopathy. Okay, so wherein they, if it is left untreated, if it is, I diagnosed early stages, it can completely be cured. If it is left untreated in the early stages, it cannot be cured. You become completely blind. So they had put the training set of true positives and false positives for the algorithm, and when the algorithm run it, and it showed that actually the people who told, the doctors who told it was normal regular people, data samples was actually positive. So even though clinicians thought it was normal, the bot said that it is unusual and it has to be actually early stages, very early stages. So that is one case. However, I will also tell you the other side of the story. See, when it comes to knowledge representation, there are 3 kinds. One is known knowns. Now what I know, I know. Then there is known unknowns. Like I know I cannot fly a aeroplane. I know that I cannot fly. And then there is unknown unknowns, that I don't know what I don't know. So all AIs are very good at only first sector. It has no concept of what it doesn't know. So for example, I am not a great swimmer also. I know that. So Yeah, sure. So if I dive into this, this knowledge will help me save myself if I because I will not jump into the middle of the ocean to risk myself. So this is where human abilities should be used to understand what is the AI capable of predicting. Thank you.
Just to add, you had a specific question of will you add more people if the expert in the loop has to come in. So let me put, yeah, so time, it's okay, but still, in every system, when you put in AI or something, you have to understand that the AI has still an accuracy or predictability of 95, 98, or whatever, 99%, whatever it is. So you have still certain percentage which is not accurate according to the measurements itself. When we go into systems like straight through processing or other things, when we want human in the loop, yeah, the system itself know what is the thing which has to be given in the expert loop. That means that if you ask 100 questions, don't think that all 100 would need the expert loop. You might need only 5 or 10. So you are decreasing it randomly by a big percentage, 95% or something. So even if you put expert in the loop, it will never increase. The AI plus human is still less than the human only.
So, thank you. Don't mistake me for saying this, because I live in a country which is much more advanced than developed country. Please give us time for more discussion. This is where India is lacking. Whatever the experts talking, I can easily learn from the Google AI. It's much more advanced. So please give your speech 20%, 80%. Keep a discussion. This is why we are lacking in the science. We are making all the technology from the developing country. Please don't mistake me. I'm a baby in front of you. Okay, let's come to my questions. I have multiple questions, but I want to post very important. Let's say. So I worked in Anthem Biosciences as a scientist. I synthesized a drug, which we send it to the United States of America. So there are people who have experience 30 years in the pharma industry. You know what is happening? If they get married, they don't get a child. Even if they get a child, their childs are getting autism. So what India AI group is going to do that? Even my son, when I have been in Korea almost 8 years, my son was affected by peripheral facial palsy, which is temporary. So since I'm a doctorate in the hydrogen energy, so I have a good contact with the Korean doctors. So I studied everything about my son's condition. He's all right now. So now tell me what AI is going to do, how it is going to rectify this problem. And question to the Colonel. You were explaining me about the robot is going to do the operation. It needs a battery backup, right? It needs power.
Yeah.
Yes. Okay, let's say your robot is doing some surgery in the heart, right? Suddenly the power goes off. What happened?
There are double checks, so is it not a possibility. There are double checks on that.
Yeah. So anyhow,
double
there is a backup, right?
Double backup.
I'm doing PhD in the battery. I will tell you when it will explode. I will tell you when it will not work. In minus 10 degrees Celsius, it will not work. Or just think about every possibilities. Let's say Bihar, where the temperatures goes above 35. Let's say Chennai, plus 30 degrees Celsius. So my focus in Korea is the electrolyte, which is very important. Why? Yesterday also I was discussing in the round table why the lithium-ion battery is exploding. Why? I think one guy in the US, he fired his Tesla car. That is because...
Please cut short here, because we are running...
yeah, so that's why. That's why. See, that is the reason.
Just very straightforward, one simple question and end it. Because otherwise everyone has so many questions.
Yeah,
and,
maybe next time you can change these things.
Please.
That's why. Thank you. I'll be leaving Korea soon. Thank you.
Yeah, thank you.
So does that mean that it will be always only robotics and human combination, or do you foresee a possibility where human is not at all involved in that kind of an operation which was shown?
See, I never said danger means blind danger. Danger means if it is used by person who are not well educated and trained on that specific surgical procedure used by robot, right? That is the danger. Say a surgery is for urology application using a robot, and if an ophthalmic surgeon is trying to do that, so that is a danger. Or if an orthopedic surgeon is going to do that, that is a danger. Because AI means, robotics means, it is very specific, it's very targeted. It has huge power for delivering the best, but at the same time, it has big danger also for delivering you the worst. But if you blindly clap that AI can do everything, then you are nowhere. Because I tell you, most of the Western world, they are spending billions and billions of dollars in AI, you know. Company like Google and Amazon, and you will never listen story on the public domain, but I know from inside they are spending billions and billions of dollars on these generative AI or LLM or whatever you call. It looks all very fancy. But when it comes to healthcare, I will never support and I will never say that you should become the first because Google is doing so, you should also do. No. Google has hundreds and thousands of failure in AI in healthcare. Do you know this? Nobody knows. I know because I am also one of the part of UN think tank for 2050. What will be the future of 2050? Using AI and digital in healthcare. So we talk all these dangers, right? So these are the gray area. Nobody say, these are commercial company. They want to get their name branded and clap because they already have burned huge money because they are $1 trillion money. For them, $1 billion money burning is nothing. But for us, it's big pain because we don't have any money. So that is the thing. We have to be very cautious when we are spending and whom we are spending money in the name of AI and technology in healthcare. You have to spend only to the domain expertise. That is what I am stressing. Not anyone, any XYZ startup who has never done anything related with healthcare. See, idea everybody have. Here, if I ask on idea on any one topic, thousands of idea will come here only. But most of the idea will fail when it reaches to the commercialization at the delivery point. So we require an idea which is successful, and that successful idea will only happens when you have experience on that idea. Shoulder 30 years in healthcare technology and innovations because I am the robotics and AI expert since 1992. University research scholar in that. I built robot during that time, but that was no demand. So that is the thing. Thank you so much. There was a very good interaction and from the gathering and from yeah.
I have a question for Anujji.
Please, I think because no, I think we cannot take any more question. Yeah. Oh, okay.
Any company in the world? Yeah. So I'll get back to you on this. We'll discuss about it. Yeah. Thank you.
I have one small message to General Das and Colonel Shah. Like Colonel Shah was giving presentation and he was wishing that why can't we can have good number of robot in our government hospital, RR or such kind of a defense hospital, and training and education related with robotic surgery and all. So we have good news for defense and other government stakeholders. Like Benevimed Healthcare Group is going to manufacture medical robots for different surgical applications, make in India, and exporting to 180 countries, and going to have in every medium size to big size hospitals in every department of hospital. And we will be having the best international education and training center for this, because in robotic surgery a good training team has to be there, and most of the time big multinational company, they don't actually care. Once they install the machine, they run, because they get the payment, they run. Yeah, so that continuous support is there, so that your junior surgeons, they also learn very good, yeah, package, huh? Okay. Okay. That's good. Yeah, that's good. So thank you very much for live interaction on this topic session.